Healthcare ecosystem provide us opportunities to stay healthy during life cycle and help us during emerging situations of our body. We have developed health ecosystem with millions of qualified doctors which help people in every day. In 2020, we have new stress challenge for healthcare system around the world, which facilitate transitions into telehealth and remote medicine. New analysis indicates telehealth use has increased 38 times from pre-COVID-19 baseline. In April 2020, overall telehealth utilization for office visits and outpatient care was 78 times higher than in February 2020. We are also seeing a differential uptake of telehealth depending on specialty, with the highest penetration in psychiatry, 50%, and substance use treatment, 30%. Consumer research shows that consumers continue to view telehealth as an important modality for their future care needs, but as expected, this view varies widely depending on the type of care. Investment in virtual health continues to accelerate. Per Rock Health's H1 2021 Digital Health Funding Report, the total venture capital investment into the digital health space in the first half of 2021 totaled $14.7 billion. COVID-19 has caused a massive acceleration in the use of telehealth. Consumer adoption has skyrocketed from 11% of U.S. consumers using telehealth in 2019 to 46% of consumers now using telehealth to replace canceled healthcare visits.
When pandemic and COVID-19 hits up, we'll start thinking how we can apply some deep kind of innovations and deep technologies to eliminate loading for healthcare ecosystems and provide new consumers experience for customers around the world. So we also start thinking, can we take, for example, no-code, low-code platform solutions integrated with AI, deep technology, and provide, for example, meta-human experience for them in digital way in one window.
When you're working with MetaHuman and AI as service provider or virtual doctor who provide consultation, you can be available 24 hours per day, 7 days per week, 365 days all year round. Virtual AI doctors didn't require scheduling, resting, sleeping, weekends or holidays as humans and regular doctors needs, and they could provide services simultaneously to thousands and million consumers in same time around the world via telehealth or digital office in one click. This solution have potential to increase hospitals and healthcare capacity, as consumers didn't need to spend their time to visit hospitals and dedicating doctors' time or finding relevant time slots, which is available on doctors' scheduling calendar during pandemic spikes and overloading hospitals. Also with some amount of patients' e-health records as medical case notes, tests results, digital prescription, x-rays and big data algorithms, we can analysis previous patients' diseases, track records, behavior from personal electronics, heart rates, body's conditions, etc., and provide more relevant recommendations in each cases. We will move into way of integrative, preventive measures of digital personal medicine to predict upcoming potential vulnerability of organism and providing needed vitamins and treatments before diseases already started to demonstrate it in the body. With help of research and development efforts from biotechnology and biohacking scientists, particularly in areas where we can do it in remote way. Psychologist, therapist, psychiatry, endocrinology, gastroenterology and others. At next steps, we can go forward and apply AI, big data and quantum computing to unlock and understand better hidden elements between molecules in our DNAs and what types of connections have direct impact on our health to increase immunity system and assist with viruses resistance for making better quality of life and longevity. Inserviss. Stay healthy. Increase your level of immunity system. For making better quality of life and longevity.